Hi everyone, my name is Paige and thank you so much for joining me here at bootcamp.com for today's lesson on pelvic MRI. So my biggest tip for you when you're learning pelvic MRI is to teach yourself on T2 imaging. So on T2 imaging, fluid is going to light up white and bones are going to be dull, but that's okay because we're not really so worried about bones when we're looking in the pelvic region. We really want to see great contrast between the tissues. So when you look at T1 versus T2, you can see how much clearer it is to see all of the individual structures on T2 when compared to T1, where all you kind of see is a blob down here. So I would recommend looking at T2, and all the images we're looking at today are going to be T2 as well. All right, so we're going to start off by looking at some features of the male pelvis on imaging. You can see we have our gross imaging on the left and our sagittal MRI on the right. Starting from this big open space in the back here, this is your rectum, and it's going to show up pretty much as a big black hole on your imaging. Again, the most posterior structure. Anteriorly from the rectum, you're going to see the bladder. Here's the bladder, and if you follow the bladder down through the path of the urethra, you'll run into the prostate. You're going to see the exact same thing on imaging. You'll see the bladder up here, and the bladder on imaging glows bright white, like I said, because it's full of fluid, and so it serves as a really helpful landmark when you're looking at the rest of your imaging. And again, so you have the bladder here, follow the urethra down, and you will run into the prostate. Superiorly between the rectum and the bladder, you're going to see the seminal vesicles. You can also see them on imaging right here. And finally, let's talk about some bony structures. Like I said, these are less important in the pelvic region, but they are good to be aware of. Here is the pubic symphysis, and then here is the tail end of the spine. Same thing on imaging. Here's the pubic symphysis, and here's the tail of the spine. All right, so we have a lot of structures to cover on axial, but there's a lot of really exciting anatomy here. First thing I'm going to point out is the rectum, and like we just saw, the rectum is going to be this big black hole on imaging. All right, from the rectum, the little tube to the front is going to be the urethra. And between the urethra and the rectum are the seminal vesicle and vas deferens, right here. Now this big glowing structure all the way anteriorly, like I was hinting at before, is going to be your bladder. Again, a great landmark. And if you're confused as to why you can see the bladder and also the urethra on the same cut, I'd encourage you to look over here at our sagittal section again, and you can see that in this patient, the bladder is actually sort of angled forward here. So the bladder angles forward, and then also the urethra is going down. So when you take an axial slice across this line here, you can actually see both. All right, so these two big symmetrical structures on either side of the action, those are your femurs. Remember, they're going to be dark gray. They're not going to glow white like they do on CT just because they're bone. So you're going to have to be a little careful when you're looking at the bony structures here, but those are sort of your big ones. And then back here, posterior to the abdominal cavity, these huge muscles back here, I'll give you one guess, those are your gluteus maximus muscles. Now, anterior to those are a really important nerve called the sciatic nerve on either side. They're going to run down here. And those have really important clinical implications. If your patient comes in complaining of radiculopathy, pain shooting down their legs, nerve pain, you should think of the sciatic nerve, and you should think about what structures might be around that nerve and check those out on imaging. All right, if you look between the femur and the bladder on either side, you're going to see these little bundles right here. And those are your obturator vein, nerve, and artery. And if you look way anteriorly coming out the front of the pelvis, you're going to see your femoral vein and artery. So here's the vein. Remember, the vein will usually show up a little bit flatter compared to the artery right next to it, which is rounder because it's got that thicker, more muscular wall. And remember, your femoral vessels are huge. If you think back to dissection, you can think about how thick they were. They're going to show up really prominently on imaging. And so those two are a really good landmark to help you find your psoas major, which is going to run right behind them. Now, one of our important structures that I'm going to come back to in a minute, but that we've already discussed, is the prostate. And the prostate is going to be this dark ring right around the urethra. And we'll talk about the different zones of the prostate in a minute, but this is the transition zone of the prostate in this cut. So let's finish off by talking about the hip flexors. So I always found it a little tricky to differentiate the hip flexors from the triangle that your femoral vessels and the psoas makes right here. But you can see that these hip flexors are really huge. Here they are up here, and they sort of have these white, almost striations running through them. That's characteristic of muscle, and that's the beauty of MRIs. You can really see those details. So whereas these two vessels are going to be hollow, you're going to be able to see some of the features of the muscle within your hip flexors. So here is your iliacus. Over here, sort of going off the edge of the screen here, that's your rectus femoris. And then up top here is your sartorius. And it'll be the same on the other side over here. All right, so as you're learning the structures, it can be tricky to tell if your axial slice is more cranial or more caudal. Alternatively, maybe you're good at that, but you're not as good at musculoskeletal anatomy and you're confused about those hip flexors. Either way, there's a really great relationship between the hip flexors that you can use as you move from cranial to caudal. So you can see the gross anatomy down there, but to me, the hip flexors kind of remind me of a maypole, right? Sort of rotating around the femur from this common point here. So they're going to start up cranially close together, and then as they move, they're going to sort of splay out and around and rotate around that femur. And so if you look at that from an axial perspective, they're going to start close together, sort of in this triangular conformation, and then they're going to spread out and around and rotate. And so you can use that rotation to your advantage when trying to figure out where you are and what's going on with those hip flexors. So cranially, you're going to see that the sartorius is sort of the peak of this triangle, and then the iliacus and the rectus femoris are sort of the base of that triangle. But as you move more caudal, they're going to spread out and rotate around. So now the sartorius is over here, the rectus femoris is here, and the iliacus is going to end up all the way back here. And we're going to see that relationship a little bit later on as we get to some of those more caudal cuts. But cranially, if we go back to our original cut, you can see the sartorius up here in the front, the iliacus here medially, and the rectus femoris laterally. All right, so let's switch gears here and talk a little bit now about the prostate. So remember, the prostate is right here underneath the bladder, and there are 4 zones of the prostate. There's the fibromuscular stroma, the central zone, the peripheral zone, and the transition zone. And we can see each of these sections really beautifully on MRI. The fibromuscular stroma runs anteriorly. The central zone is going to be back here, and that's the section, if you remember, that the ejaculatory duct runs through. We've got our urethra running through the central zone here, and then our peripheral zone is back here. So we have our 4 sections here. You can see the urethra running down too, and the ejaculatory duct coming down to meet it, running through that central zone. So let's take a look now at an axial cut, and we're going to be taking a look through slice B. So right here at slice B, you're going to be able to see the fibromuscular stroma, the transition zone with the urethra running through it, the central zone back here, and the peripheral zone on either side. And your urethra is going to run through right here, and your ejaculatory duct runs through that central zone right here. Moving on down now to this level here of the perineum, we're going to be able to see a couple more muscular structures. So here very clearly is this line of the urethra running through. You've got your corpus spongiosum on either side forming the bulb of the penis here. And then that big muscular corpus cavernosum is going to be right up here. And now if you're wondering why that stops right here, it kind of seems like it would go all the way back. That's what the image sort of seems to be telling you. This back here is actually bone. These are your ischial tuberosities. Now, thankfully, once you know to look for this division, it is pretty clear on imaging, but it is just something to be aware of. And finally, I just wanted to bring your attention to the spermatic cords, which are out here superficially. All right, so let's take a second to pause here and see if on this image you can identify and name the 3 hip flexor muscles. So go ahead and pause the video, give it a try, otherwise I'll give you the answer. So remember, now we're in a much more caudal slice, right? We're right towards the bottom at the level of the perineum. So your sartorius is going to be up top here. Your rectus femoris is in the middle. And your iliacus is all the way here in the back. And you can see now how much they've straightened out from that triangular conformation. All right, so we are done with the male pelvis. We are moving on to the female pelvis. So take all that, put it to the side. This is a whole new set of anatomy. But we're going to start with that constant landmark, which is the rectum. So over here, you've got the rectum again, that big open dark space. You're going to see the exact same thing in the female anatomy. However, your next structure anteriorly is going to be that birth canal. So you've got the vagina and then the uterus coming up. And on our patient here in real life, it's flopped down a little more than it is in this cadaver specimen. But you can still follow the birth canal up through the vagina. Here's the cervix, and then over, around, here's the uterus, and then down. Then right here is your bladder, and again, glowing the brightest white. That's going to be a great landmark for you. And then your pubic symphysis over here, and tail of the spine over here. All right, let's take a look axially. So if you look over here, you can see that we are above the level of the bladder. So unfortunately, we don't have that landmark, but the uterus lights up decently nicely as well. So here I am outlining the myometrium, and the uterine canal is going to be right in here, highlighted in blue. The rectum is still that big black hole, and then here's going to be our cervix. And if you're confused again on how am I seeing, a lot of the uterus and then also the cervix, again, just take a look at this sagittal here. You can see that the top of the uterus is actually flopped down anteriorly, and that's how you're getting both of those on the same cut. And then finally, on either side of that uterus, you're going to find the ovaries. So here's one over here, and you can see sort of the outline of one over here, but if you're wondering what that is right there, that is actually an ovarian cyst glowing bright white. So a fun little incidental finding for you here on imaging. But this one over here is your normal. All right, taking things down caudally now, let's take a look at our urinary bladder, which is glowing white per usual. Behind that is our urethra. Behind that is the vagina. And then behind that is the rectum. And you can see the ischiorectal fossa right here on either side to help orient you that that's the rectum. Let's take a look at our bony structures, namely the femur on either side and the greater trochanter. And that femoral artery bundle is going to be superficial in the exact same place we talked about on the male pelvis. Here are your 3 hip flexors on either side, sartorius, rectus femoris, iliacus. And then here are your obturator vessels, and they look a little different than they did in the male pelvis just by virtue of the level of the cut. Here we're watching them travel through the obturator foramen, so that's why they're looking a little more longitudinal. All right, so I know we covered a lot of ground today, but let's go into some more fun practice questions. So Mr. PH is a 70-year-old man reporting to your office complaining of a weak urinary stream, an increased urinary frequency, including nocturia, for the past couple of years. So this is kind of an ongoing problem. And I want you to take a look at his imaging here. Talk to me about some structures you can identify, what abnormality you might be seeing, and what you think is going on. So take a minute, pause this video. Otherwise, I'll go ahead and give you the answer. All right, so some structures you should be able to identify from here. You should be able to see the bladder glowing bright white. We've got the prostate right here, and the urethra right here in the middle. Here's your rectum, big black hole. You can see the sort of half-moon outline of part of the femur. We can see our gluteus maximus way back here. And we can see our femoral vessels up here with our psoas right behind. Now, you can't see the hip flexors on this one, which is why it's always really important. If you thought those were the hip flexors, go back, figure out what maybe happened. But just remember that these are a little bit smaller and they are more medial. So if you can't see both of them, what is more medial, that's going to be your femoral vessels. And remember, too, they have those clear, dark lumens. And so in terms of identifying an abnormality, this prostate should be jumping right at you. That is a huge, huge, huge transition zone of the prostate. And you can also see that the quality of the tissue itself, it looks a little more heterogeneous. And that 100% explains his symptoms, right? So if you have this giant prostate, it's going to be compressing the urethra that runs through it. And so you're going to have incomplete emptying, which is going to result in increased urgency. And this is called benign prostatic hyperplasia, and this is a really, really common problem among older men especially. So you will 100% be encountering this once you reach the clinic. All right, question number 2. So Ms. RP is a 30-year-old G4P4 woman. If you're not familiar with that terminology, that just means that she's had 4 live births. But she's complaining of fecal incontinence, feeling a moderately painful bulge, as she describes it, in her rectal and vaginal area when she sneezes or moves her bowels. She's also describing fecal incontinence and pain during sex. And so they put her through an MRI defecography. So if you're not familiar with what that is, basically they're going to put barium paste in your rectum, and they're going to have you move your bowels into a special MRI machine, basically, so that they can watch the movement of your pelvic cavity as you use the restroom. So here on the left is before she started to defecate. Here in the middle is as it's happening, and here on the right is immediately after. So take a look at her pre-defecation image on the left. Talk to me about what different structures you can see. And then look across the 3 images and see how the positions change as she moves her bowels. What do you notice is maybe happening? And then what do you think is going on? What do you think is causing her problem? So take a minute, pause this video. Otherwise, I'm going to go ahead and give you the answer. So here on the left here, you can see the pubic symphysis, the bladder, again glowing white, the uterus and vagina right here in the middle. Here's the rectum, and the reason it's glowing white like that is because they put that glowing barium paste into it. But you should have been able to identify that that was the rectum anyway, just by virtue of the position. And then up superiorly above all of that, you can see her small bowel. So as she moves her bowels, take a look at specifically at her rectum and her birth canal. So let's start with the birth canal. Here is the uterus and the vagina. And then if you look as she defecates, her small bowel is actually going to push down on the top of her uterus. And so it goes from here to here to here. And not only that, but it seems to be shortening. So whereas before you had all this space here, now all of a sudden you really only have the length of the uterus, which means that her vagina might be experiencing some prolapsing. Similarly, if you look at her rectum, over here is pre-defecation. And then as she moves her bowels, you can see that she has expelled the barium here. But when you look at her rectum, you can see it prolapsing down and out. And again, you can see that small bowel pushing down on things from the top. So what she's got going on here is a full thickness rectal prolapse, as well as what's called an enterocele. So entero, remember, is the prefix for small bowel. So her small bowel is pushing on top of her uterus and causing a vaginal prolapse as well. So she has a rectal prolapse and an enterocele. This is very common in women who have given birth. It's a pretty unpleasant problem. So you got that hint in the stem, right, which was she had had 4 live births, and that might have been the cause of her problem. So that's all I have for you today. Thank you so much for joining me. If you have any questions, comments, concerns, problems, troubles, worries, hopes, dreams, fears, send them all my way. Otherwise, if not, good job, good luck, and keep practicing.